Hello there, and welcome to our webinar in partnership with Beautiful Medical. I'm Anna Dobby, I'm the editor at Aesthetic Medicine magazine, and we're going to be talking about a holistic approach to full face and neck rejuvenation. Today, Dr. Ryan Hamdy is here to discuss the science and clinical applications of non-surgical radiofrequency. Dr. Ryan Hamdy, if you don't know him already, is a cosmetic doctor with 20 years of experience in aesthetic medicine. And he has a clinic and a training academy in Cheshire, UK, as well as being a consultant and trainer for Beautiful Medical. He's also the KOL and trainer for Galderma, a faculty member and trainer for Dermafocus, and a consultant and trainer for Regen Lab PRP. So without further ado, I'll hand you over to Dr. Ryan.
Thank you very much, Anna. Thanks everybody for attending today. I know a lot of you have got very busy clinics, so I'm very privileged that you've decided to join us on this webinar. But we'll keep this nice and concise. This is not intended as a sales pitch as such, but hopefully we'll give you some basic knowledge about radiofrequency and a little bit more about AGNES RF, which is the device that we're going to be talking about today. This is a little bit about myself. Anna's already gone through that, so I won't dwell too much on that. AGNES RF, it's a funny name. The company tells me that AGNES is a cutting-edge medical device that utilizes RF technology to offer a wide variety of medical and aesthetic treatments. Now, obviously, that's a bold claim, and but actually, it's a fair claim. I took my AGNES on about 2.5 years ago, and I have to say it's really changed my practice. It's a tool that I use pretty much every day, and it's a tool that I think most people will value at some point in their aesthetic practice. AGNES, as I said, it's a strange name, and I tried to understand where this name came from. In ancient Greek, AGNES meant pure or clean, and I know that the creator of the device initially intended this to be the treatment for acne, so maybe there's a link there. If you go on to ChatGPT, I don't know if you guys are using that sort of technology now, but it comes up with an acronym: Advanced Generation of Non-Invasive Energy Systems with Radiofrequency. Again, I don't know whether that's true or not. For all I know, it might just be the creator's mother's name. I really don't know. In any case, hopefully after this webinar, you'll join us in some workshops, get some hands-on experience, and learn a little bit more about the device and why it's such a useful tool in your practice. I'm going to talk about the physics of radiofrequency, because a lot of us have heard the term radiofrequency, but we don't really understand what it means or what it is. Generally, the method of operation of the vast majority of energy-based devices that we have in our clinics are through the generation of heat. So heat generally is the common pathway, whether it be radiofrequency, whether it be microwave, whether it be ultrasound, or any light-based devices. We're generating heat, which then has an influence or an effect on the tissues that we are trying to treat. With radiofrequency, specifically, this can be subnecrotic, so the heat levels can be relatively low, the temperatures can be relatively low, and in that sort of instance, we're after fibroblast proliferation, after stimulation of metabolic processes. Alternatively, that heat can actually be quite aggressive. It can be ablative, it can be necrotic, it can be coagulative. So depending on the device and what you're trying to achieve, this heat can be delivered in a selective manner, and As you can see, I've got a picture of a hybricator there, and I have one of those. So selectively, it can be an electrocautery device where we're using a very fine probe or a fine needle, or it can be non-selective, where we're just trying to achieve bulk heating of tissue. And you can see there the electrodes tend to be much larger, or there's an array of electrodes where we're trying to create subnecrotic heating. But what exactly is RF? We sort of know it's a form of energy, we sort of know it's a form of radiation, but what exactly is it? And so what I'd like you to understand is the concept of the electromagnetic spectrum, okay, and the physics of radiation. In front of you, hopefully you can see the electromagnetic spectrum, okay? This represents pretty much all the light, most of the energy that's available in the universe. And what we want to see is where does radio frequency actually sit on this spectrum? Energy typically travels in waves. Radiation is simply a way that energy is transferred. If you look at this, we can see on the far right we have very high frequency radiation in the form of gamma rays and X-rays, and we know that these are probably not good for you, although there are medical applications for these sorts of energies. These are termed ionizing forms of radiation. They're quite damaging to tissue, damaging to DNA. As the wavelengths lengthen, we start moving into ultraviolet radiation, and we know that that comes from the sun. And again, that's probably not very good for us. As the wavelengths tend to increase, we go into the visible light spectrum. And this is the stuff that we can actually see with our eyes. And then as we extend that, we go into infrared. We can't see infrared, but we can feel it. It's heat. And then we go into microwaves, where the wavelengths are longer, and then radio waves is where we're talking about radio frequency, the long wavelength end of the spectrum. This is non-ionizing, so a lot less damaging to human tissue and to human DNA. Another concept I'd like you to get your head around when we talk about radio frequency, sorry, bear with me, here we go, is frequency. There is a difference between wavelength and frequency. Wavelength is the distance a wave takes to complete a cycle. The frequency is the number of cycles within any given second. Look at that graphic, okay? You can see the various frequencies that are available to us. On the left-hand side, we have household appliances, and we know that the AC current that comes to us through our sockets is roughly about 50 or 60 hertz. 50 or 60 hertz. If you stick your finger in that socket, you'll get an electric shock. If we move along the frequency scale and go up to 100 kilohertz, so this is 100,000 hertz compared to 60 hertz, this is where stimulation of muscle and nerves stops. So beyond that, we don't tend to experience electric shock sensations or cardiac issues. Then we go a little bit further along there and we have electrosurgical devices. So they typically start around 450, 500 kilohertz, and they extend anything up to 5 or even higher megahertz, which are millions of hertz. Most radio frequencies, which are AC in nature, operate between 0.3 and 5 megahertz. AGNES, which is the device that we're going to talk about today, operates at a frequency of 1 megahertz. RF is not chromophore dependent, and that's quite important. Okay, it doesn't need a color. It doesn't need a specific target, and as such, it is a form of non-selective thermal energy. We don't need color as a laser might need. So we understand the frequency, we understand where it sits on the electromagnetic spectrum. It's a form of radiation. But let's have a think about the parameters that influence RF delivery and how it affects tissue. There are 4 key parameters that I'd like you to think about. The first is energy density or fluence. And we'll look at that. Energy density. Again, we're just going to go back to basic physics, and I just want to talk about watts and joules. Watts are a unit of power, and you will know that by a light bulb that you put into your ceiling, your lamp, typically 50, 60, up to 100, 150 watts. Okay. Joules is a unit or a measure of energy, and that's the amount of watts that are delivered over a period of time. So joules is watts times time. Fluence is slightly different. Fluence is joules per centimeter squared, per unit of area. So fluence is a measure of energy density. And if you've got lasers in your clinic or you've got other energy-based devices, you should hopefully be familiar with that term. Now, this is important because fluence actually dictates how damaging a potential treatment can be. Okay, the tissue effects depend very much on the heat that's applied and the temperature that's achieved. And we can see from this next schematic, next table, the effects of increasing temperature on tissue. At the lower end of the spectrum, we have, things at mid-30s up to the mid-40s. At that sort of temperature, we tend to see metabolic stimulation. We tend to see fibroblast stimulation. When we start going up a little bit higher, up to into the 70s or 80s, we start seeing coagulation of soft tissue. We start seeing protein denaturization, collagen contraction, and then we start getting close to 100 degrees C. We start seeing vaporization, carbonization, and ablation. AGNES, the device that we're talking about today, typically operates at about 75 to 85 degrees. So we'll experience some metabolic stimulation, but we're aiming for coagulation, collagen contraction, and protein denaturization. The next factor is radiofrequency depth and penetration. Okay, now this is again an important thing, an important concept to get your head around. This is typically a function of the type of electrode and the geometry of that electrode. If you look at that image there, okay, you've got a needle sticking in the skin. Okay, now if you want high energy, high temperature, you want to ablate, your spot size tends to be small. If we look at the other end of that image, we've got a larger spot size, and we've got subnecrotic heating. The highest temperature is going to be nearest to that electrode, and then as the energy spreads out, we get some divergence of their energy, and we lose some heat. Now, this potentially can be a problem, because how can I apply an external electrode and guarantee myself that the heat that I'm going to generate is going to be sufficient to target maybe fat in somebody's abdomen or wherever? The key with AGNES is that there is a unique array of needles which can deliver the higher temperatures at very precise depths. So when we talk about the needles a bit later on in this webinar, you'll see that we have a variety of needles at a variety of depths that allow us to target very specific tissue planes. Another important aspect to bear in mind is how tissue conducts energy, how tissue conducts electricity or radiofrequency, whatever. And this can vary widely. Okay, we're all aware that water is a good conductor of electricity. You've seen it in movies and things where people are standing in a pool of water and then somebody puts an electric current to that and they get an electric shock. Now, if you look at this table, blood, which is essentially a liquid, plasma with some cells floating around in it, is a very high conductor of electrical current. Skin, which has a relatively high water content, is not far behind. Hydrated skin is even higher, wet skin is even higher. But when we start talking about fat and bone, we don't treat bone, but certainly fat, you can see that the conductivity of fat is actually pretty low. And so to achieve the melting point in fat, we actually need almost 10 times the amount of energy that skin would need. And so it's important to understand this. You know, there's no value in treating different areas with the same energy densities. And again, one of the key advantages of AGNES is that ability to alter the parameters to achieve the desired outcomes. Lastly, I want to talk about waveform, radio frequency waveform. RF can be delivered in a number of ways. It can be continuous. Okay, and we see that, you know, when you're trying to create some bulk heating in a large area, it might be an abdomen or wherever, and that's a continuous way where you are just creating a thermal effect, a diffused thermal effect. It can be a burst mode where we're trying to achieve peak power over a short period of time. We might be trying to coagulate or necrose something, or it might be in a pulsed mode where we're trying to, via short, sharp pulses, to limit the amount of heat spread and damage to collateral tissue. And we see that typically with various microneedling devices. The interesting thing with AGNES is that the waveform is actually slightly different. You can see from this image here, typically most RF devices deliver their energy in a sinusoidal manner. So this is a typical up and down, whereas AGNES will deliver their energy in a much more square type of wave. And the reason for that, and there is a reason for this, is that you can see once you've achieved peak power, with a sinusoidal wave, it tends to fall down the hill. With AGNES, you've achieved peak power and then you are straight down the cliff. Okay, and what this means is that we are leaving less residual heat in the skin as a result of that waveform, and as a result, hopefully reducing the chances of collateral damage to tissue that we don't actually want to affect. So why is AGNES so unique? Well, if we think about those parameters, we can start actually getting an idea as to why AGNES is unique. The fluence, the energy density, we have ultimate control of that. We control the power, we control the pulse duration, we control the energy density. Very important. Depth of penetration, we can control that. We have precision. We have specifically designed needles of varying geometries, of varying lengths. Understanding the conductivity, we really need to know this. It allows us to tailor, it allows us to be accurately offer proper fluences at the right depths with unique accuracy. And with the squaring off the waveform, we can target the tissue that we want, but limit collateral heat damage, which is important. But because we have so much flexibility in the system, we can produce multiple treatment protocols. And it makes really AGNES, I have to say, one of the most versatile RF-based devices available for you today. Quickly, just want to talk about the needles, because this is a key part of the success and the safety profile of the configuration of the needles that are available to us. They're micro-insulated, they vary in length and in number, they're T-shaped, allowing for maximum transmission of energy, and the device actually has a camera. which allows you to look at the needles and look at the integrity of that insulation. I'll have a quick look at that now. Sorry, I'll switch off the music. This is the device, and we can see we've put the needle into the machine, and we can ensure that the insulation, which is actually really important, is intact. Oh, sorry, that was very quick. Clinical applications. Well, they are numerous. Here we have a lot of medical applications, ranging from acne, acne scarring, and a whole variety of skin conditions, ranging from syringomas, blackheads, xanthelasma, sebaceous hyperplasia, which we treat a lot, perioral, periocular wrinkles. We also have a number of aesthetic indications, submental fat, jowl fat, buccal fat, lipomas, bra fat, SMAS tightening, brow lifting. In my clinic, it's largely facial sculpting, so it's largely lower face, buccal, jowl, submental area. That's what we tend to use our device for. A little video on a treatment for double chin. Hopefully, we can have a look at this. Right, I'll keep the music off. We switch the machine on, and we wait a short time, and it switches itself on. There we go, and we pick the level, we pick the pulse duration, which is all we give you guides for all this this information. The needle that we're going to use is the F3A, so it's a 5mm 3-pronged needle, insulated. Again, it's checking the integrity of the insulation, and you can see there it's intact, and so we're good to go. Just remember, it's a monopolar device, so we need an earthing plate. So that typically goes, if you're treating the face, typically goes between the scapula. We're marking out the area and making sure the patient's sitting up. We anesthetize the area. Now, this is an uncomfortable procedure. You cannot get away without anesthetizing the area. And typically, I will use just lidocaine, but people will use a concoction of lidocaine, adrenaline, and some sodium bicarb. In this sort of area, the submental area, you'll typically be using 5, 7, maybe up to 10 mils of lidocaine. Treatment. Okay, so the needles are being inserted. Typically, the distance between the insertions is 3 to 5mm. Got to make sure that the needles are properly inserted. There's always going to be a little bit of bleeding and bruising. And what you'd like to hear, what you want to hear, is a crackling sound. Now that sounds a bit weird, but you want to hear that sort of frying sound, and that's a good sound. That's a good sound. It indicates that you're in the right tissue plane. You're going to bruise. It's going to bleed. It's going to bruise. It's going to swell a little bit, but you know that's maybe a week, maximum 2 weeks. We should speed this up. For particularly fatty areas, you may do a second pass. And here they've put a dressing on. I have to admit, I don't bother with the dressing. There's minimal swelling. You know, I often look at this and compare it to fat dissolving injections where you get significant swelling, a lot of downtime, and you need a lot of repeat treatments. So this for me is much easier, much more predictable. We're going to quickly look at another video. So the music off on that. This is treating acne. Okay, so we're using a slightly different needle. We're inserting it into the follicle. We're trying to destroy the hair follicle. That's sebaceous gland, sorry. So they've done the treatment, and then a few days later, what we're using is another probe, a multipolar probe, to melt the debris and remove that. It works really well. I don't particularly use it as an acne treatment because I've got a lot of other treatments, a lot of other options, but it's a very effective permanent solution to acne. Where are we? Okay, quickly, a few seconds on periorbital wrinkles. Again, is this something I use in my clinic? Not so much, because I've got other toys that I can use. But it works well. You've got to stretch the skin well. The needles, there'll be different needles to use in this sort of area. And you can see, again, typically 3 to 5 millimeters between insertions. Got some before and afters. This is a lady with a lot of submental fat. I think we've done 2 sessions here. I think she's actually probably had a 3rd session since this image. But you know, it's a nice result. I mean, she's pleased. This is another lady with a little bit of jowl fat 6 weeks after the 1st session, and you can see the improvement and the improvement in the neck as well. This, I know she's stretching her chin out a little bit, but she responded very well. So she had 2 sessions, but she also had some mid-face filler as well. And this is the same lady from the anterior view. She's smiling because she's really happy about the results. But again, you can see the general improvement. Here again, little bit of jowl. It doesn't show up very well, but it's the neck that particularly bothered this lady. She had poikiloderma, so we also did some IPL on her neck. And this is important because this is not a standalone treatment. Okay, this is something that you can use in combination with pretty much anything else that you have in your toolbox. And here we've just got a lady with a little bit of jowling. And this is 2 weeks after the 1st session, so this will continue to improve over the subsequent 6, 8, 12 weeks. That's it. Thank you very much. We have a series of workshops that are planned, so please contact Beautiful Medical if you're interested. Thank you.
Thank you ever so much, Dr. Ryan. That was really interesting. So if you guys want to ask a question to Dr. Ryan, please pop it in our chat box. But otherwise, I have a couple of questions. What are the risk factors and complications for the device?
You know, risk is one of those things that is sometimes very difficult to quantify. Risk is something that we experience every day in every aspect of our lives, and particularly when it comes to aesthetic treatments, it's based on your experience, it's based on your training and on your own limitations in terms of what you feel you can and you can't do. But what can go wrong? Well, like any energy-based device, there are things. There's bleeding, there's bruising, there's hematomas, there's scabs. We can burn the skin if you don't insert the needles properly. There's something called embossing, and we sometimes see that around the eyes where we see needle marks around the eye. That usually resolves 2, 3, maybe 4 weeks, but the patients often don't like that. The other thing to bear in mind is, particularly when you're dealing with the lower part of the face, the mandibular branch of the facial nerve runs along here. It's underneath the platysma, but it's most vulnerable just here in this pre-jowl sulcus. So when we're teaching people how to use the device, we show you techniques to try and avoid that risk. I've never experienced it, but what you don't want to do is damage a nerve. Remember, a nerve is covered by a fatty sheath, and we don't really want to disrupt that. Otherwise, it's actually it's relatively safe. It's, patients will feel a little bit numb and a little bit sore maybe for 3 or 4 weeks. The bruising typically disappears over a course of 7 to 10 days. But in my experience over the last 2.5, 3 years, we've not experienced or seen any significant issues or complications. So as long as you counsel the patient properly and they understand what can and what can't happen, they're fine.
I think you've mentioned it as well, but like, how many treatments do you think are necessary to sort out a?
Yeah, it depends. It depends on the issue. It will range from anywhere between 1, 3, maybe even 4 sessions. Somebody with just a little bit of isolated submental fat, 1 session is going to be enough. If you're treating some periocular wrinkles, 1 to 2 sessions. If somebody's got a big neck, a thick neck, heavy neck, typically it's going to be 3 to 4 sessions. It's, you've got to make the patient aware that, if they can get away with 1 treatment, they're doing well. I don't commit patients to buying a course of treatments. What we usually say is, let's play it by ear. Let's see if we reach a point, maybe after 1 session or after 2 sessions, where you are happy. Remember, particularly when it comes to facial slimming and contouring and sculpting, we are permanently disrupting those fat cells. So it's a permanent treatment. Now, obviously, that patient gains a lot of weight over the subsequent months. The existing fat cells that are there get bigger, and so the jowls or the neck or whatever area you're trying to treat will become an issue again. If they maintain their weight, it's a permanent treatment.
We've had a question from Janet Amakie, I hope I'm pronouncing that correctly, and it's to do with the use for acne specifically. Do the needles cause keloid scarring and hyperpigmentation in melanated skin? And also, how does it compare to Roaccutane use for acne?
It's a completely different treatment, isn't it? Roaccutane it works on sebaceous glands, reduces sebaceous gland activity. This is a destructive process. Okay, the needle's going into the sebaceous gland, and you are burning, coagulating, cauterizing, whatever term you want to use, that sebaceous gland. So when that sebaceous gland is treated with AGNES, that sebaceous gland is non-functioning permanently. Remember, these needles are insulated. Okay, so we're not creating a lot of energy or heat soak into the dermis. But particularly on darker skin types, with any energy-based device, the risk of PIH, post-inflammatory hyperpigmentation, will exist. It's not something that we have seen in our practice, although I have to be fair and say, where we are in our clinic, darker skin types, we see very few of them. We see some Asian skin, we see some black skin, but very, very, very limited. So yes, I understand that this is a potential issue, but it's a different issue. Now, if somebody is on Roaccutane, I would clearly wait at least 3 months before they're offered Roaccutane before you offer a treatment like this. But it's a permanent treatment, okay? It is permanent destruction of whatever sebaceous gland you are treating.
And what combination treatments does it work with?
Combination treatments basically means you can combine it with anything else. Okay, you can see some of those cases combined it with some filler, but you can combine it with other skin tightening treatments. You can combine it with we're very big into regenerative medicine now, and so you know, our the way we practice is completely different to how we practiced maybe 5 or 10 years ago. So we're often combining these sorts of treatments with PRP, with things like polynucleotides, with sculpture, and with other energy-based devices as well, IPL, and fractional CO2, which we do a lot in our clinic. But there are no limitations. You know, you'll get patients who are coming to you in their 50s and 60s, and they're very heavy jowled, they're very heavy in the neck. And you know yourself, you know, putting a mil of cc of filler soft gel into the cheeks isn't going to lift that jowl. Okay, so you need to contour, you need to reduce the amount of weight that's there, and then maybe you put some filler in afterwards, and you'll get a better result. You know, the better quality of the skin, the less weight there is, the firmer the skin, fillers will give you a better result following those treatments. So there's no limits. Do I combine treatments at the same time? Of course I do. Yeah, I mean, you know, we have another device called Double Tight, which is from AGNES, which is an amazing skin tightening device, and we will remove fat with AGNES and then tighten the skin immediately afterwards. There's no reason why you can't do the two. You may as well. The patient's going to be battered and bruised. You may as well get it all done in one session. There's no reason why you can't do those treatments in the same session.
And how long would you say before patients will see the results they want?
You know, it's funny. Some patients, immediately after you've done the procedure, you can see some changes, but typically it's a couple of weeks. I won't offer a repeat treatment for maybe 6 to 8 weeks. Okay, but 2, 3, 4 weeks, you typically I'll bring patients back after about 2 weeks just to make sure they're healing well and there are no issues, but you are seeing improvement even at that early stage.
Fab. And how cost effective is AGNES?
It depends on what you're comparing it to. Okay, obviously, if you're comparing it to liposuction, it's probably very cost effective.
What about compared to a fractionated laser treatment, for example?
Again, it depends. If I'm treating periocular wrinkles, for instance, that you've got a number of options, haven't you? You've got various injectables, you've got various lasers, you've got various skin tightening devices. The advantage with AGNES is that you've got a lot of that all in the same device. So in terms of cost effectiveness, it will say I haven't. You know, I've been doing this a long time, so I've collected over the years a lot of bits of equipment. So we do have a lot of fractional stuff, lasers and skin tightening devices. But you know, if you wanted one device to treat a lot of indications, I think you really can't you can't do much better than AGNES.
Well, I think that's all our questions. Thank you ever so much, Dr. Hamdy. If you want more information, then the details are on the screen, but also follow Beautiful Medical on Instagram. Thanks for attending, and I hope you all have a lovely day. Bye.